I bled for 3 years straight.
I had 2 heart attacks and a stroke.
I had diabetes, right?
I was badly beaten. I had problems.
I had a nagging backache, and it turned out to be lung cancer.
Poverty is difficult, and there's a lot of issues. And I think that one of the unique things about Bread for the City is we can take this very holistic approach to people. And depending on what they need, can we meet their needs in terms of food, helping them with housing, etc., helping them with employment. But if you're not healthy, if you don't have your health, it's hard to get anything else done.
Well, Bread for the City is a nonprofit that's been around actually since the mid-70s. They provide food, clothing, medical, legal, and social services to low-income residents here in Washington, D.C.
One of the great things about working here over time, a couple things. One is that it's really fun. You walk on the streets and everyone recognizes you, knows who you are, and asks you their medical questions. And, oh, quick, I ran out of my medicine. Come see me tomorrow in the clinic.
Big hospitals, the compassion for the patients. It's nothing like here.
I once had a woman say to me, you know, it's really nice that you're still here. You haven't given up on us. And so many people give up on us every day, and we give up on ourselves. And I feel that to know that we are a rock as part of the community, we're not going anywhere, you can count on us, means a lot to people who have lost hope.
The doctor that had seen me made me open up to share what I was going through, and I was in a situation right in and there, and he just really, he made me feel safe, and ever since then, I come here.
We do have a limited number of new patient appointments.
I know, it's really hard. There's a lot of people calling in, but you can give us a call again tomorrow morning at 9.
I'll try.
Okay, call right at 9 a.m., okay? Okay, good luck.
Well, we don't have enough exam room space. You can see how crowded we are in here. This is our workroom space. And we do have a real need for more rooms. Certainly on the mornings that I'm here, we have sometimes more providers than we have rooms, and that's a problem.
Primary care is really hard to find. There's this huge need. We've got to kind of meet this need. We can do a great job. We can relieve some of the burden off of the emergency rooms, save the city money in that sense.
But if I had to go to an emergency room or something like that, which is a non-emergency, you know, I lose a whole day. I lose a whole day. So right now, I think this is like heaven.
I was belligerent against everybody, and I was still sleeping on a park bench. I've had blood clots off and on since 1983. So I became involved with their medical clinic, who proceeded to save my life not once, not twice, but 3 different times.
Okay, thank you so much. Okay.
One of the big things going on for us is a move to expand our ability and our capacity to provide health care to medically uninsured and medically underserved residents living in D.C.
But there'll be a big kind of a grand corridor right through here, and we'll break through over there where people can get their food.
Right now we serve primarily adults, and that's sort of been the segment of the community we focused on. So one of the visions for the new expanded clinic is to bring a lot more families and children.
There's a great need to see more kids in the clinic. I constantly get asked during routine visits to follow up with either their new babies that are being born or their 3 or 4 kids that they have.
We'd be able to see a lot more patients, hopefully having more providers. We will be making new patient appointments again tomorrow morning at 9 o'clock. Once the new patient spots are filled, it's pretty hard, and you understand that they're really trying to get into the clinic, but there's also not very much we can do just because of the limit.
Some people would have no place because Bread for the City takes the homeless. Bedford City takes people with no income. Bedford City will take somebody like me.